Is there any other means you can work and earn far more above £21,000 a year as a healthcare assistant in the UK? And are you going to be stuck as a healthcare assistant forever and ever here in the UK? Or are there any other career progression, career development you can take up while working as a healthcare assistant? Hey, my name is Chinyere Ojike and you are absolutely welcome to my channel. So if you are new to my channel, do not forget to subscribe to my channel, like this video, drop your comments, turn on the notification bell so that you get notified each time I upload a video. So I got this question from a subscriber, a concerned subscriber, asking if £21,000, that is the average salary of a healthcare assistant in the UK, especially when you are employed on a full-time basis, when you do like 35, 38 or 40 hours a week of shifts, so you are paid something around, that is the average salary of 21,000. NHS pay as from 19,500 to 21,000 and above, and private employers can pay you something above that. So someone is actually asking if there's a way he or she, I think it's a she, could be earning more money aside of that 21,000 in a year as a healthcare assistant doing full-time in this country. Well, I am here to tell you the truth and nothing but the truth. Just like I've always shared in this channel, I keep everything real and practical. The answer is absolutely yes. I give you instances. I know a healthcare assistant who earned far more 30,000 in a year. How does she do that? Just working in one place, it depends on the kind of opportunity you found. She is employed to work for 40 hours a week, but she does more than 40 hours a week in that particular home where she works. Why? Because the job is not that stressful to her, and her shift, she does nights. She lives opposite of her workplace. So basically she starts her shift 10 o'clock and then she finishes in the morning. I don't know the time, but all I know is that she still goes home to do school run for her children, morning and afternoon, then go back to work, So she earns something around over 30,000 in a year, 30,000 pounds in a year, And where I just resigned from, everyone is employed to work for, you can only work for maximum of 35 hours a week. I worked there for 21 hours a week, but you can take up more shifts. There are opportunities for you to take up extra shifts if you want, and there are opportunities for you to say no to extra shifts if you do not want, or if you are not disposed to take up, because they will always ask you, or maybe somebody is dropping a shift, they would want to know if you are chanced to cover such a shift for the person who is taking an off, who is unwell for some reasons, So they always ask their staff, instead of calling to give that shift to an agency, they would ask their staff first if anyone is willing to cover such shift. The person should take it up internally rather than them giving it out to the agency. So particularly you have chances of earning far more above 21,000 pounds in a year. Even if you don't want to be working in the same care home where you are employed, or they don't normally have extra shifts for their staff, you can enroll with one of the agencies around and start working for an agency. Remember, your 35 hours or 38, 40 hours a week is something you can do within a space of 3 days. Yes, because if you do 14 hours times 3, it's almost 48 hours. So what happens to the rest of the 3 days you have? You can choose to work for 2 days again, 2 days extra shifts, and then relax on one of the days, possibly on Sundays. Though sometimes when you are on a permanent employment here, full-time employment here, you don't choose the days you are going to be working. Everything is quite flexible here. And if you don't want to be doing your extra shift or making extra money by doing care work, there are minor jobs you can do in this country. Packaging jobs are available. You can do this for 2 hours. Work in the shop floors that are very next to your house or close by your house. You can choose to work for 3 hours, 4 hours, 6 hours, as the case may be. Some mothers even go to work from 9:30 a.m. because school starts here 8:45. That's when the school opens for the children. You leave your child in school. As from before 9 o'clock, you're running to your workplace, depending on how close it is. You start work 9:30 in the morning and you close 2:30. I've mentioned that in this video. There's a banker that works 5 times in a week like that, working from 9:30 to 2:30. The work routine here is made easy for everyone, so you can choose to be doing extra shift in the shop, or cleaning job is the one that you can even finish before your children wakes up from sleep, depending on the time they give you. You can even do night on cleaning jobs. But in schools, you do cleaning job for like 2 hours, you are done, you go back home. By so doing, you are earning far more than your 21,000, and 21,000 pounds is not a cap to your salary as a healthcare assistant. It's just the average salary. All right, in response to the second question you asked, if there are any career progressions or development for a domiciliary care worker, as a healthcare assistant, can you progress in your career? Can you, enroll into any other career? The answer is 101% yes. You can progress. You can go into some other professions, even outside of healthcare. You have opportunities to train yourself in this country. And in as much as you keep working as a healthcare assistant, every now and then they provide you with advancement trainings. Very day I resigned from my work as a healthcare assistant, I had a training on that very day, a paid training added to my CV, So, but if you want to train in something that is, maybe you want to progress from a healthcare assistant to becoming something like a nurse, going into becoming a doctor, honestly, you can. I know that recently on social media, you have seen a video of a young man in Nigeria precisely. He was a cleaner. From becoming a cleaner, he became an accountant. A cleaner in the same bank where he was working. Started working as a banker. He went to school. While going to school, he was still, I don't know how he did it, because I know in Nigeria, they always employ people on 8 to 5, So I wouldn't know how he did it, going to school and working as a cleaner until he graduates to start working as a banker in that place. But here, honestly, it is quite easy for you. Just that if you want to train as a nurse, it requires a lot, because you are required to do placement, 2,500 placements for you to become a nurse in this country. And remember that when you are doing this 2,500 placements in the hospitals and the care homes, it is unpaid training. That's the sad part of it, And for an international student, you have to be paying for your nursing program. And it will be really sad when you go to work, when you are sent on a placement, because I have seen people on placement, when they come to do their placement, they spend about 12 hours. They work the same shift as healthcare assistants. The same hours of shift. Imagine being on a shift for like 7 hours, 12 hours, and you are not paid for it. Though it is better for those who are already citizens of this country or who have gotten their permanent residency, because the government pay them. Yes, while you are studying here, they pay you. But if you are a foreigner, you don't get paid for it. And if you are already working as a healthcare assistant on full-time work, full-time employment, they give you COS for you to come in here. Remember, you are to be doing your 35 to 40 hours a week shift for your employer. You might want to cover your shifts. Maybe you do it towards the weekend, possibly from Thursday, Friday, Saturday, Sunday, and then you use 3 days to go to school. Yes, you can achieve it. You use 3 days to go to school or do your nursing placement, because everything about health, natural sciences, is totally practical. Yes, it's absolutely practical. You learn on the job, So nothing is, you can achieve anything you set your mind to achieve if you are hardworking, if you are determined, and if you have your family around you, you can achieve all this. Definitely, you can become a physician, that's a doctor. You can also become a nurse. You can become a nurse practitioner. A nurse practitioner is different from a nurse. I think it's higher than a nurse, because a nurse practitioner works like a doctor. They can see patients as doctors, prescribe medications and all them stuff, examine patients, So you can become a physiotherapist. You can go into all this field. Recently, one of my colleagues at work, she left. She just graduated. She became a paramedic. Can you imagine? She was formerly a healthcare assistant and she was training. She is a British citizen though. So while working as a healthcare assistant, she became a paramedic, which is absolutely good. There is nothing you cannot become. I see students, secondary school students who have come of age of 16, working as a pharmacy assistant. You can also become a pharmacist. Yeah, so there are a lot of opportunities. You can train yourself. Now, fantastically, even doctors who came into this country from foreign countries, especially Africans, they progress from becoming a medical officer to specialize in certain aspects. Basically, while you are employed as a doctor in this part of the world and you choose to do a training, you choose to specialize, maybe internal medicine and different kind of medicine, you choose to specialize. While you start your training, I tell you, but your salary will go down a bit. Why? Because they are taking the money for your training from your salary, which is something okay, because it is better they keep taking it gradually every month than you paying the cash, you know. And when you go for some of these trainings, they cater for your hotel where you are going for the exam, your transportation, and otherwise. The same thing is applicable to the nurses and all the people working in healthcare sectors. Just like you as a healthcare assistant, any training that is being given to you in your workplace is being paid for by your employer. Yes, they pay for it when you come for training, 4 hours of training, 5 hours of training. You are the one getting this knowledge and you still get paid for it. You know, so this is how you can advance in your career opportunities in this part of the world. Basically, there is always room for advancement, room for progression for you to become whatever you tend to become. You do not get stuck at just becoming a healthcare assistant unless you choose to be. You know, nobody is forcing you to remain adamant, to remain stagnant at one level of profession. You can progress and you can earn more money, just like I've emphasized in this very content. Thank you so much for your time. I sincerely appreciate your time watching and listening to me. I hope this helps you a lot and gives you more morale, you know, to pursue your career or your dream of coming in here as a healthcare assistant while pursuing your career in more higher levels. All right, see you again in my next upload. Subscribe to my channel if you haven't. Bye for now.